Welcome to our deep dive on coronavirus.
Specifically COVID-19.
Yeah, COVID-19.
Mhm.
We're going to be using excerpts from the World Health Organization website,
Like WHO.
right, the WHO, to give you a solid understanding of this disease.
Hopefully go beyond just the basics,
Yeah, definitely.
Yeah.
So let's just jump right in. What exactly is COVID-19?
So COVID-19 is an infectious disease
Okay.
that is caused by a virus
Uh-huh.
called SARS-CoV-2. And the interesting thing about this virus is
Yeah.
it can affect people in wildly different ways.
So it's not just like,
Yeah.
oh, everyone gets a bad cold or...
Not at all.
Okay.
Some people might experience mild symptoms,
Okay.
but some people can become seriously ill.
Uh-huh.
And this is particularly true for older individuals.
Yeah, that makes sense.
Or those with underlying health conditions.
So really it can impact anyone regardless of age.
Exactly. And that's why understanding how it spreads is so crucial.
Yeah, for sure.
So think about it like this. When someone who is infected with COVID-19 coughs, sneezes, talks, or even breathes, they release these tiny liquid particles from their mouth and nose.
And those particles carry the virus.
Exactly.
I
And
know.
those particles can be...
Are they visible? Can we see those?
Not always.
Okay.
Some of them are larger droplets that you might see, but others are microscopic aerosols
Oh, wow.
that can linger in the air.
Wow.
So that's why even those seemingly simple actions like
Yeah.
covering your coughs and sneezes,
All right.
wearing a mask,
Uh-huh.
and isolating when you're sick are incredibly effective in preventing transmission.
It's amazing how something so small
Yeah.
can have such a huge impact.
Absolutely. And it really highlights why vaccination is such a powerful tool.
Yeah.
Vaccines essentially train our immune systems to recognize and fight the virus
Okay.
before it can cause serious illness.
So prevention is really the name of the game.
Definitely.
The WHO recommends this multi-pronged approach that includes vaccination,
Right.
physical distancing,
Uh-huh.
mask use,
Yep.
proper ventilation,
That's important.
frequent hand washing,
Yes,
and covering coughs and sneezes. It sounds like a lot,
it does.
but it makes sense when you think about how this virus spreads.
Exactly. Each of these measures works in a slightly different way to disrupt the chain of transmission.
Okay.
So, for example, physical distancing reduces the chances of encountering those infectious particles.
Yeah, makes sense.
While masks act as a physical barrier,
Right.
and proper ventilation helps disperse those particles,
Okay.
making them less concentrated.
So we're kind of building like a fortress
You could say that.
against this invisible enemy.
And it emphasizes that a collective effort is really crucial in curbing the spread of COVID-19.
Absolutely. So let's talk about the symptoms. What should people be looking out for?
Well, the tricky thing is that COVID-19 can manifest in such a wide variety of ways.
Okay.
Depending on the person,
Uh-huh.
it's not a one-size-fits-all situation.
So there's no like one symptom where you're like,
right.
oh, definitely COVID.
Right. But there are some common symptoms to be aware of.
Okay. Like what?
So, fever,
Oh, wait.
cough tiredness,
Huh?
loss of taste or smell.
Yeah. Those are the ones you always hear about.
Yeah, those are the ones that are often the first signs.
But there are less common symptoms too.
Absolutely.
What else is there?
Some people experience a sore throat, headache,
Bugly.
body aches, diarrhea,
Wow.
even a skin rash or irritated eyes.
So it really runs the gamut.
It does. It
Oh,
can be tough to differentiate from other illnesses.
Yeah. So when should someone seek immediate medical attention?
That's a crucial point.
Yeah.
If you experience difficulty breathing,
Okay.
shortness of breath, loss of speech, or mobility confusion, or chest pain,
Those are serious.
those are serious red flags, and you need to get help right away.
Yeah. You don't want to mess around with those.
Exactly. Early intervention can make a huge difference in outcomes. And of course, for milder symptoms, resting, staying hydrated, and monitoring your condition at home is usually sufficient if you're otherwise healthy.
So this whole incubation period thing,
Yeah.
I've always been kind of curious about that.
Oh.
What does that actually mean when we talk about COVID?
So the incubation period is the time between when you're infected with the virus
Okay.
and when you start to show symptoms.
So like the virus is in there.
Yeah, think of it as the virus setting up shop
Okay.
before it makes its presence known.
Gotcha. So how long is the incubation period for COVID?
Typically, symptoms appear 5 to 6 days after infection.
Okay.
However, it can take up to 14 days for symptoms to show up.
So someone could be walking around feeling totally fine,
Yeah.
but spreading it.
Unfortunately, yes.
For 2 weeks.
And that's why understanding the incubation period is so critical for those contact tracing efforts.
Right.
Identifying potential exposures and implementing quarantine measures early on can significantly help contain the spread.
So important. It is mind-boggling, isn't it?
It is.
How this microscopic virus can just cause havoc on a global scale.
Right.
Speaking of the global impact,
Yeah.
what role has the World Health Organization played in all this?
So the WHO has been at the forefront of the global response to the COVID-19 pandemic.
Okay.
They play a crucial role in coordinating international health efforts.
And what does that look like in practice?
So essentially, they monitor global health trends.
Okay.
They provide technical guidance and support to countries around the world.
Uh-huh.
And they develop evidence-based recommendations for prevention and treatment strategies.
So they're kind of like the central hub
Yeah, you could say that.
for information and guidance
Sure.
during a global health crisis.
Exactly. And they also work to ensure equitable access to vaccines and healthcare resources,
Wow.
which is essential for a coordinated global response.
That sounds like a monumental task.
It is, but they've been remarkably effective.
Hmm.
The WHO has been instrumental in coordinating research efforts, facilitating the sharing of critical information, and mobilizing resources to combat the pandemic on a global scale.
I mean, it's amazing how they bring together
It is.
so many different countries and organizations
Right.
with different priorities.
Yeah, different resources.
Never everything
Absolutely.
to work towards this common goal.
It truly highlights the power of global collaboration,
Yeah.
especially in the face of a shared threat like COVID-19.
And it's also underscored the importance of public health infrastructure, hasn't it?
Absolutely. We can't afford to wait for a crisis to hit before scrambling to react.
Right.
We need strong public health systems in place beforehand.
So what are the key elements of a strong public health system,
Well,
especially in light of what we've learned from this pandemic?
so adequate resources,
Okay.
expertise, and the capacity to rapidly identify, track, and respond to health threats is paramount.
So it's all about being proactive
Exactly.
instead of reactive.
When those systems are in place and functioning well, they not only help manage outbreaks more effectively,
Yeah.
but they also improve overall health outcomes in countless ways.
So it's not just about pandemics.
Right. It's about...
It's about creating a healthier society as a whole.
Absolutely.
Investing in prevention, promoting healthy behaviors, ensuring everyone has access to the care they need are all vital components of a thriving public health system.
And speaking of access to care,
Yeah.
I mean, this pandemic has really
Right.
shone a light on the disparities
For sure.
that exist in healthcare access and outcomes.
It certainly has.
Yeah.
The pandemic has been a harsh reminder that certain communities are disproportionately affected by health crises like this.
And those disparities are often rooted in,
Right.
systemic issues
I
like
do.
poverty discrimination, lack of access to quality healthcare.
These inequities need to be addressed if you're going to build a more just and equitable health system.
We can't talk about public health
Right.
without acknowledging these fundamental inequities.
You
Exactly.
get put certain populations.
At a greater disadvantage.
For sure.
Yeah.
The pandemic has underscored the need to prioritize these communities
Absolutely.
and ensure that everyone has an equal opportunity to be healthy.
It's about creating systems that are fair, just, and truly serve everyone regardless of their background or circumstances.
A goal we should all be striving for.
Absolutely.
Switching gears a bit, I find it fascinating how the virus itself
Right.
has evolved over time.
Yeah.
We keep hearing about new variants emerging.
It's constantly changing.
It's constantly changing.
Viruses are, by their very nature, constantly changing.
Yeah.
It's part of what makes them so challenging to deal with.
How do these variants actually emerge?
Okay, so as the virus replicates, it can sometimes make errors when copying its genetic material. These errors are called mutations.
Okay.
And some mutations can lead to changes in the virus's characteristics.
Like what kind of changes?
So things like how easily it spreads, the severity of the illness it causes, or even its ability to evade our immune system's defenses.
It's like this constant evolutionary arms race
That's a great way to put it.
between the virus
And our immune systems.
and our immune system.
And it highlights the need for ongoing monitoring of the virus.
Okay.
And adapting our strategies as needed to stay one step ahead.
That's where genomic sequencing comes in.
Right, exactly. By analyzing the virus's genetic code,
Okay.
scientists can track how it's changing, identify new variants as they emerge,
Right.
and understand how those variants are spreading.
Wow.
This information is crucial for developing effective vaccines and treatments.
I mean, it's remarkable how far science has come in terms of our ability to do this kind of analysis.
The advancements are happening at an incredible pace.
Yeah, it gives me hope for the future.
Me too.
Hmm.
It's crucial to stay informed, adapt to new information as it becomes available,
Right.
and continue working together to meet this ongoing challenge.
You know, as we're discussing all this, I can't help but think about the long-term impacts
Right.
of this pandemic.
Yeah.
We're still grappling with the immediate effects, but what about the ripple effects?
That's a critical question.
Yeah.
We're still learning about the long-term consequences of this pandemic.
Uh-huh.
There are so many factors to consider,
Okay.
from the economic and social impacts
right.
to the toll it's taken on mental health.
It's like we've all been through this,
Yeah.
like collective trauma,
Yeah.
and we're still trying to process it.
That's a very apt analogy.
Yeah.
It will take time, support, and understanding to process the full scope of what we've been through.
For sure.
We need to be mindful of the mental health challenges many are facing
Yeah.
and ensure people have access to the care and resources they need.
And this brings up, we were talking about this earlier,
Yeah.
that public health isn't just about physical health.
It's about mental and emotional well-being.
It's about the whole person.
You're absolutely right. We need to take a holistic approach to health
Yeah.
and recognize the interconnectedness of these different aspects.
Absolutely.
As we look ahead, it's clear that we have a lot of work to do in addressing the long-term consequences of this pandemic.
Yeah, it can feel overwhelming.
It can.
But we also have,
Yeah.
a lot of knowledge and experience to draw from.
We do.
We've learned so much about this virus,
Yeah.
about ourselves, about the importance of collective action.
That's the key takeaway.
Right.
We've faced immense challenges in the past, and we've overcome them.
Yeah.
We'll overcome this one, too.
We will.
But it's going to require sustained effort, collaboration, and a willingness to learn and adapt as we go.
And that brings up a crucial point that we haven't explicitly addressed yet,
Okay.
which is this concept of individual responsibility.
Right.
We've talked about the roles of governments and organizations and scientists,
Yeah.
but what about our own actions?
Right. What about us?
What role does individual responsibility play in navigating this pandemic?
Yeah.
Yeah, it's easy to feel powerless,
Yeah.
during a global pandemic.
Absolutely.
But I think it's important to recognize that
Right.
we do have agency,
Yes.
even in the face of such a widespread crisis.
We can't just rely on others to keep us safe.
Right.
We also have to take ownership of our own health and well-being.
That means staying informed, making responsible choices,
Yes.
and considering how our actions might affect others.
Precisely. It's about understanding that we're all interconnected
Yeah.
and that our individual choices can have ripple effects throughout our communities.
So what does that look like in practice?
So in practice, individual responsibility during a pandemic
Uh-huh.
means adhering to public health guidelines, like
Right.
getting vaccinated and practicing good hygiene.
Right.
But it also means being considerate of those around us,
Yeah,
especially those who may be more vulnerable,
for sure.
and advocating for policies that promote health equity and ensure everyone has access to the resources they need to thrive.
It's about using our voices and our actions
Yeah,
to create a healthier
absolutely.
and more just world.
For all,
That's a powerful reminder that we all have a role to play
we do.
in shaping the future of public health.
And that our collective efforts, both big and small, can have a profound impact.
I'm struck by how much we've covered in this deep dive.
It's been a lot.
We've explored, the science behind the virus,
Right.
the global response,
The complexities of it all.
the importance of public health infrastructure, the challenges of health equity,
Still so much to do.
the evolving nature of the pandemic.
It's been quite a journey.
It has.
And I hope our listener has gained a deeper understanding
I think so.
of this really intricate and dynamic situation.
Before we go, I want to leave you with a final thought.
Okay.
What will you do differently tomorrow, having joined us on this deep dive into the world of COVID-19?
How will you use this knowledge to navigate your world with greater awareness, compassion, and resilience?
The world has undoubtedly been changed by this pandemic.
It has.
But the question remains, what will the post-pandemic world look like?
And what role will each of us play in shaping it?
That's something for all of us to consider. We hope this deep dive has provided you with valuable knowledge, ignited your curiosity, and left you feeling empowered to navigate this complex world. We'll see you next time on The Deep Dive. Stay curious, stay informed, and stay well.